We asked you to submit your coronavirus questions on our official KDKA Facebook page. Tonight, we're pleased to welcome Dr. Brian Lamb, an internal medicine specialist from Allegheny Health Network. He's here to give us some answers. Doctor, thank you for being here. I will note that you and I greeted with an elbow bump as opposed to a handshake, which you'd approve the widespread adoption of such.
I do.
All right, let's get right to the questions. These came in on Facebook today. Cheryl McCall asked, I have heard several reports stating that face masks will not help in the spread of the virus. If that's true, why are all medical personnel who are either transporting or coming in contact with any possible infected person wearing such a mask?
Well, not everyone is wearing them. The people that are wearing them in the face masks that we see from the public health sector, these are trained professionals. And so their masks are usually slightly different than the ones that people can buy over the counter. One of the things you have to remember is for a face mask to work, it actually has to have a tight seal around the face, and you can't have air particles coming in. And so the recommendation is the regular masks that people would buy aren't going to protect them.
So the kind of mask you see on the screen right now, that's
not going to protect. Yeah, unfortunately, that's not going to protect anybody. Yeah. You can see that particles can get in. The other thing is people who aren't used to wearing masks, it's a little uncomfortable, and some people may actually touch their face more.
Counterproductive.
And it's counterproductive.
All right, let's move on. Terry McHale Hackemer asks, is there reliable testing available to detect the virus? It's a question because the CDC did have some problems initially with the first tests that were developed.
Yeah, we do have the testing. Unfortunately, it's not widely available. I know, and we just talked about in the last segment, unfortunately, we don't have the capability to do widespread testing at this point. They're still working on that, trying to come up with new solutions and making sure the tests are as accurate and as sensitive as they can be.
So because a lot of testing is not being done due to the unavailability of tests, is it likely that there are cases circulating in our area that just have not been tested for?
It is. It's very likely. It's likely that actually worldwide that there are many more cases than what we've actually seen. When we think every year, the flu affects over 1 billion people worldwide. And not everyone's tested, and that's based on estimates. And so we're probably looking at something where many hundreds of thousands of more people have been infected or been exposed to this virus than what we're actually seeing.
And in most cases, it's mild.
In most cases, 80% of the cases, people have either no symptoms or very mild symptoms.
All right, let's move on to Mary McMasters, who asks, how long does the virus survive outside the body without a host?
So we're still looking into that. Right now, some coronaviruses have been found to live for up to 9 days. Others live for a few hours. Right now, we're seeing just how long, and it does depend on things like the humidity level, the temperature, and the surface that the virus is on.
9 days.
Up to 9 days in some cases. Now, every coronavirus is different. That we're talking about, a multitude of different coronaviruses. And seeing how long this one actually lasts.
Okay, so we don't know.
So we don't know.
Follow-up, is there a certain type of environment where the virus thrives best? Temperature, humidity, that sort of thing?
So most viruses actually love winter temperatures. They like a little bit cooler temperatures, and they like it a little bit drier. Warmer temperatures and higher humidity, viruses tend to not live as long outside of the human body.
Okay, Justin Douglas asks, when it comes to a fever, what number is the virus? Anything over 100 or higher than that?
There is no specific number that we can say that this is coronavirus. Low-grade fevers can be found in anything. High-grade fevers can be found in a lot of different illnesses. So there's no magic number that we can say this is definitely coronavirus versus flu versus a common cold.
All right. Oralee Sampy Harshman asks, how long does it take to get well? And how is it decided when someone is well enough to go out in public?
Well, we're still looking into that. We're looking at when people can go back out into the public. Right now, some of the studies that have come out have shown people can still be infective for 5 to 10 days after their symptoms abate. And so, it's very hard to say for sure. Again, we follow what we see with most other viruses, the cold virus, the flu virus. And, it will take several days, and there's no safe number. And so the 14-day quarantine, we're not really sure that that's, going to be adequate.
It's frustrating.
It is frustrating.
We want hard and firm answers to these. I understand that there aren't. Linda Norge asks, I'm flying to Arizona and then Texas this weekend. Is it safe or should I postpone a trip? With spring break coming up, a lot of people are wondering, is it safe to fly?
So for that, I would actually recommend everyone go to the CDC website. They have the travel advisories. No one can tell you whether it is safe to fly. And no one can say, this is a good idea or this is a bad idea. The best thing that you can do, look at the CDC recommendations, and you have to judge it for yourself. One of the things that we don't want to do is we don't want people to panic. We don't want people to curtail things that they need to do, places that they have to go. Again, if you use general precautions, hand washing, trying not to touch things, not shaking hands with people, that goes a long way in preventing the spread of the disease.
All right, we are out of time. Dr. Lamb, thank you so much. Hopefully we can have you back when we can say some of this stuff is absolute. We've nailed it down.
Exactly.
And it's the not knowing that is so frustrating about
It
this.
is, and that's what really causes a lot of people to be fearsome. And we're just hoping that people realize, you know, it is. We understand that it's scary, but at the same time, common precautions can help.
Thanks, Dr. Lamb. Give
You're
you the
welcome.
bump. All right,
Thank you.
I'll send it back to Christine.